Hi, it is Dr. O'Gwyn here, and I want to help you manage your low back pain that might be brought on by sitting too long. I have a lot of patients that come in and say, Dr. O'Gwyn, it hurts after about 15 or 20 minutes when I'm at the office or at a chair or just doing work from home. And the problem becomes sitting. Usually we get rounded, we get flexed in that low back, our entire spine rounds. But as our spine rounds like that, and sitting puts a lot of compression, especially in that rounded position, it puts a lot of pressure on the discs in between the bones of the spine there. And this becomes problematic and creates a lot of pain. So you have options, and I'm going to go through a few options on some things that you can do to try to relieve that pain. Option number one, of course, is put something that's going to offer you some support in that low back. So you can get a lumbar spine support, or fold up a towel, a small pillow or something that you can wedge right in there in the small of your back. And you'll notice that when I'm there, it holds this in place so that I can't do that. So really you're trying to prevent that. You want to be here and not here. So I put something back here, and that's going to keep you nice and upright. Notice also how when you're slouched like this, everything comes forward. You know, pretend I'm at a computer here. So as we put something here and get upright, everything seems to just come back. So there's this, and then there's this. And this is where you want to be for good posture and good alignment. All right, so option number two is something called a McKenzie extension. You're going to be on your forearms, elbows are under the shoulder, and you just hang out here. Nice, relaxed, let that pelvis sink down into the floor, and you're extending backwards. I'm not using my back muscles to hold me up, I'm using my forearms here. Nice, relaxed. If this increases pain, if you get a burning pain in your low back, especially if you get any pain going down the legs at all, this is not a good stretch for you. I would not do this, and I would find a spinal health specialist. But for most people with the flexion intolerant low back pain that we're talking about, this is going to feel pretty good. So your options are to hang out here, and as you hold this for about 15 or 20 minutes, the pain should slowly dissipate and go away. If you feel like you need a little bit more, you can get on your arms here, get on your hands, and just push up like this. Let the pelvis sink and relax into the floor. And with either one of those, you can hold that for about 30 to 60 seconds. This is called a McKenzie extension. Great way to undo all of that flexed position on the lumbar spine. And finally, a really important thing to do is to stand up. Get out of that chair. Every 20 minutes or so, you should really stand up. You can slowly arch backward, undo that compression, that flexion, and go into a little bit of extension here. A lot of people find it helpful. Reach arms overhead, really reach. You could reach backwards. You can reach and reach side to side. So a lot of people like these stretches here. So again, those are your options. One, as you're sitting, put something, a wedge in between that low back or lumbar spine support. Do those McKenzie postures that I talked about, where you're laying on the floor and extend backwards, and get up frequently, reach, extend backwards, try to get that decompression on your spine there. So hope those helped you out, and if you have any questions, as always, you can leave a comment or feel free to contact us. All of our contact information is below. Thanks.